And welcome back to Island Life Live. Our next guest is a local boy, graduate of Kea'au High School on Hawaii Island. He obtained his medical degree from the John A. Burns School of Medicine at the University of Hawaii at Manoa and is known today as the Robot Doc. Orthopedic surgeon Dr. Paul Norio Morton joins us right now. How are you, brother?
Good. Thanks for having me on.
Doc, thank you so much for coming back. Now, you've earned the moniker of the Robot Doc because of your skill in using the robotic technology. We saw the machine for knee and hip replacement. But today you're going to talk to us about non-surgical pain relief, which is very, very exciting. We don't want pain, so this is good. Using orthobiologics. That is a big word. Can you explain what that is?
So orthobiologics, or orthopedic biologics, they're another type of injection or another type of treatment that we use for a lot of people who are trying to avoid surgery, or sometimes you're looking for a treatment that can actually help cure a problem.
So what are some of the benefits of orthobiologics?
So there's a lot of people who are coming around with tendon pain, ligament pain, or even osteoarthritis, and orthobiologics are a way of basically resetting the biology within the knee using an injection to try to help stimulate return of function and getting people back and healthy.
And using your body's own system? How does that work?
So basically there's a couple of ways that we can generate orthobiologics. So there's PRP and then there's stem cells. And I'll get into both a little bit.
Okay.
PRP is platelet-rich plasma. And basically what we do is we take your blood, we spin it down in a centrifuge, and then we use the concentration around the platelets, and we'll actually inject that into the affected part.
Back into your own system?
Well, specifically if it's a joint or a muscle or a tendon that we're trying to target.
Wow.
The nice thing about that is that we're really pulling out the concentration of growth factors that are really there to help rebuild your body. And
the other nice part about it is if it's non-surgical, I mean, I'm assuming that you get like healing is quicker?
It's quicker. It's also getting you back to normal. So there's a lot of people who come in with tennis elbow or osteoarthritis. They've kind of been dealing with chronic pain. And this is one of the ways that we help restore normal function.
That's awesome. Now, is that what is that? Is that a kit for the blood draw?
So there's a lot of different ways to get your blood draw and then get out either PRP or bone marrow aspirate, which is another way of actually capturing orthobiologic. But when you're looking at a kit, I think it's really important that you want something where there's basically a lab within a kit. And so, we'll get, blood, say from you, right? You're asking if I was going to take blood today. And then you'll actually inject it into the kit. And then it'll spin, you put this whole kit into the centrifuge, and you'll be able to spin it around in the centrifuge.
Wow.
And then it separates the different parts of the blood, and we can actually isolate different components. So we can get things like PRP, which is what we talked about. Mm-hmm. We can also get something called alpha-2 macroglobulin, which is actually a molecule that's really interesting that can go into the knee or another arthritic joint and actually stop enzymes that cause arthritis.
Wow.
So we can actually sometimes put a pause on arthritis and actually help people have joints that work longer and give us function for a longer period.
Again, using what's already in your body.
Yes, using something that's natural.
I love that. And again, without surgery, which always, especially for our kupuna, it takes such a long time, takes a lot out of them. How do you know which one you would need, whether it's the surgery or the orthobiologics?
So I think it's really important to get a good diagnosis. So I think talking to somebody who's trained really well in musculoskeletal medicine, like an orthopedic surgeon,
That's you?
That's right. That's really how you're going to get the right diagnosis, and the right diagnosis then leads to the right treatment.
I love that. Now, we do have a full screen graphic where, because you have your office here in Honolulu at the Ala Moana Medical Building. Mm-hmm. You also have one in Kunia and Kona, right?
Correct.
And if people want to get a hold of you, how can they do that?
You can either go to my website, drmorton.com, or give me a call, 808-439-6201.
Dr. Morton, thank you so much. This was so insightful for us, especially for those who would like to, come see you without having to go through the surgery. This is a great option for us. Dr. Morton, thank you again.
Thank you for having me.
All right,